Welcome to Robert Wood Johnson University Hospital Somerset's Health Talk. I'm Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group. In accordance with social distancing due to the COVID-19 pandemic, I am hosting this show from the studio, and our guest will be joining us remotely via video conferencing. Technology has changed so many facets of our lives in recent years, including healthcare. Robert Wood Johnson University Hospital Somerset recently implemented a new electronic health record. Through an application called MyChart, it allows patients to access their medical records and test results, schedule appointments, and check in online. On today's show, we will learn more about MyChart and its benefits for our patients from our special guest, Harshal Shah, Digital Experience Manager for RWJBarnabas Health. Thank you, Harshal, for being here. Harshal, can you please tell the audience a little bit about yourself and your role in RWJBarnabas Health?
Sure. First of all, thank you for having me, Dr. Oshinsky. I really appreciate it. My background really stemmed from a patient portal background. So in my history, I've launched multiple patient portals. I went to school to get my master's in healthcare administration at Seton Hall, and I also get my MBA at Drexel. I started my healthcare journey over 10 years ago, focusing on really that patient engagement perspective more than anything. At RWJBarnabas Health, I oversee and focus on anything digital experience that's related to patients as well as providers. So I also oversee telehealth for the whole health system, also encouraging and engaging with other non-Epic customers at RWJBarnabas Health to focus really on that patient experience perspective and really growing the patient satisfaction across the board.
Thank you very much for telling us a little bit about yourself. Now, for the audience themselves also, what the audience needs to understand is that RWJBarnabas Health Rutgers Medical Group is going to a full Epic system for all physicians, hospitals, etc., with the first part of the group already on Epic, and every couple of months, more and more will be joining. Hopefully, within another year or two, we'll all be on the same system. By us all being on the same system, this will definitely improve patient health experience. The biggest problem that most patients have at this time is when they go to multiple physicians. Each physician has their own telehealth portal, to have their own EMR system, and very few of them interact with each other. Therefore, they feel as if every part of their data is in little silos. By RWJBarnabas Health Rutgers Medical Group going to this single, well put together system, the patient will have a much better experience and, in addition, have the benefits of MyChart. Now, can you explain to the audience what MyChart is and how it interacts with the Epic system?
Yeah, MyChart is the Epic's personal health record as well as their personal engagement tool. So when a system or a location goes on Epic, we're going to standardize all those features into one singular access point for a patient. So that one front door for the patient is going to be MyChart. MyChart will, really provide that benefit to the patient of accessing information across the whole health system. So, like you said, patients right now today are seeing certain things in silos, data in kind of a silo mode. So what MyChart will provide is that unification and standardization of going into one area to access all the results from the whole health system, including the Rutgers RWJBarnabas Health Medical Group.
And what's really nice for the patients themselves is that it includes all of the aspects of their healthcare that will be part of RWJBarnabas Rutgers Medical Group. And in addition, since it is an Epic system, the patients, if they go to any other physicians who are Epic physicians on other systems, that will also be put into their MyChart.
Yeah, so with MyChart, you get the interoperability piece, which is really that connection that you have with other healthcare providers. When you go to RWJBarnabas Health, access MyChart, and if you went to another health system that has Epic, you can actually get information directly from that health system directly into your personal health record of RWJBarnabas Health. We wanted to create that standardization. We wanted to create that, one single access point. So, today we see a lot of patients taking their care to the front level. They really want to be engaged throughout the whole process of their care. So we wanted to make sure that throughout this process, we make that a priority, and patient experience is that priority.
And patient experience also helps improve the health care for the patient themselves. Tests don't have to be repeated if they've already been done. Results can go from my office over to the specialist's office without the specialist even having to order the test. And any x-rays, et cetera, are already embedded in the chart. So not only does the patient see the results, the person who orders it can see the results, their specialist can see the results also.
Yes, and all those things are going to be right at the access point of MyChart. With MyChart, you're really providing that patient with a full view of what we have, what they can see across the board. So if they did go to a facility at RWJBarnabas Health and they went to another one, later in the week, next week, or any other time, that provider at the second facility can access all that information directly in Epic. And MyChart is going to give that patient the exact same perspective of really providing and visualizing their care from multiple facilities at RWJBarnabas Health, as well as engaging with those facilities throughout the whole health system.
And what really helps is, as a primary care physician, when my patient goes to an RWJBarnabas Health emergency room, I can actually see the records as they're occurring in the as the patient's in the emergency room, and thus when the patient comes to see me either later that day as a follow-up or the next day, I have every bit of information there without having to call the facility to have them fax me the records, again improving the patient's health and health care itself.
Yep, and you touched on it earlier. It really minimizes that multiple test scenario. It really kind of engages that perspective. So you have everything you need right when the patient is walking through your door. If that patient has gone through an ED department or was an inpatient and needed to see you immediately after their discharge, it's really that cumbersome perspective of unification.
And for the patient themselves, do they need any special software? Can they access it on the computer, on an iPad, or an iPhone?
So MyChart is available on our mobile phones, on an Android device, on an Apple device. You can go to your respective stores and download the app and select RWJBarnabas Health. It's also accessible via the web. So if you have a computer, you can log into our RWJBarnabas Health MyChart right through there. And it's simple, easy access. It gives you all the information right on the front screen. It gives you what you need to sign up, what you already have, all those bits of information right there, right with the patient. And
so the patients are able to actually access their records immediately upon going into MyChart. So if something's happening right now, it's there as soon as possible.
Yeah, so most results are going to be available right through MyChart today. When as a new patient, I went to Somerset, got lab work done. I should expect the results in MyChart, inclusive of accessing previous results. So if I've had previous results at an RWJ facility, I may also be able to access it once the system is fully on Epic as well.
The other thing that is patients are able to schedule themselves. Is that true?
That is true. So today we have, and again, I want to start by saying that we're continually improving this prospect and feature. But today, patients are able to schedule themselves with an outpatient or ambulatory provider. So your primary care physician, your internal medicine physician, your family medicine physician, your specialty physician. You can schedule it right. Either if you have access to MyChart, you can log into MyChart as an existing patient and schedule your appointment, or you can use. If you don't have access to MyChart, you can use a tool for scheduling that is also available through our website called Open Scheduling, right through there by selecting your specialty and selecting the provider and the times. What that will do right now is that will actually schedule you directly with the practice immediately. So you have that, you have that safety net, you have a time slot at the provider's office, and along with that, when you do sign up, you can complete all your pre-questionnaires before you even go into the actual practice. You can finish your questionnaires about your medication, your allergies. All those questionnaires are available to the patient before they even come to the appointment. So when they're at the physician's appointment, they have minimal paperwork.
So again, what you're doing is by improving the flow of stuff prior to the patient coming in, those same 20 pages that most patients have to fill out, sign, et cetera, don't have to be done at the time of visit. Again, improving the patient's experience at the time of visit.
Yep, exactly. And then, if there are any questions that the patients may have that I'm not sure about this, they can definitely, use MyChart to get more information, because MyChart has educational tools available to the patient as well.
And the other thing you were saying is, for instance, as they're leaving my office, if I tell them that they should see a cardiologist at RWJBarnabas Health, and I give them that name, they can actually schedule themselves into that cardiologist, basically in my waiting room on the way out.
Yes, they can definitely do that. So, you can go on, and again, MyChart access point is via your phone, your computer. So if you were to tell a patient that, I'd really like you to see a cardiologist, the patient can do it right there and then, almost immediately.
Okay, so the question everyone's going to have is, how secure is my data in MyChart? Can someone hack into it? Is it private? Can I designate it only going to certain people?
Yeah, so all those features are available. MyChart is completely secure. It's HIPAA compliant. It's a software that is provided to us by Epic. It is available to yourself as a patient. If you'd like access to, let's say, your kids or your parents, your grandparents, that can also be done through MyChart via a process. Some of this process is something called proxy access. And, for certain age groups, there's a form required that needs to be filled out. But if the patient is allowing you to access their record, you can directly have a patient sign in, send a link essentially to you as a proxy and get their access. So it's a step-by-step process. It's completely secured for the patient as well as the proxy.
Which is terrific, because in our old system, only one person could access the records. And especially as a primary care physician who sees a lot of elderly patients, a lot of times the daughters, sons of the elderly patients would like to have access to it. And in many of the older systems, they were unable to get the access to that.
Yeah, that's 100%. And I think, this is really going to provide that fully functional care plan for the family, the caregivers, making sure that they're keeping up to date with the care that's being done with the patient. If they have any questions, they're able to also talk to the patient about, talk to the physician about. So it's really providing that communication tool for the patient as well as the caregiver and the proxy.
If a patient decides that they want to opt out of MyChart, do they have that ability?
Yes, they do. They can simply contact either our support number or contact the practice, and they'll be able to opt out of MyChart if they're not interested.
And if there are any technical difficulties, how do we help them?
So today, we have a help desk for all patients, working through MyChart, even from a sign-up process all the way through figuring out where their test results are in MyChart. We have a number available right on our login page. It's on our brochures, and it's on our webpage. So it's, that number is the support number for any technical assistance and any guidance that they may need, any step-by-step processes they need to learn about, all through that support number. We also have a support email address that's also on the login page. So if they are unable to call at that time, they can also email us, and we'll be getting back to them as soon as possible.
The other thing that's good about MyChart is that the patient has the ability to actually send secure messages to the providers, asking them questions if they had forgotten something or asking for more information. Isn't that true?
That is true. So when a patient logs into MyChart, they're an existing patient. Let's say they've seen Dr. Ashinsky. They can log into MyChart and communicate with Dr. Ashinsky's practice. Let's say if I have a medication question, if I need a refill, all that can be done through the communication tools and the messaging functionality that's available within MyChart today. The other functionality that, along with messaging the clinician, is also if you have a question about is this procedure covered? I have a question about demographics. Can I update it? And MyChart allows you to update all your demographic information right through the portal. It gives that access point for the patient so they can log in, update their address, update their phone number, right through MyChart without communicating with the practice or the health system. So at the next appointment, when they do come in for any of the procedures or a practice appointment, they can have the updated information right there.
What I actually find very helpful is also when the patient goes through their medication list, they're actually able to put a little note in saying, I'm not taking this medication, so that medication can be deleted from the patient's chart. And in addition, if they do have a question, they can bypass the tree that they have to go through in order when they call the office, and it avoids a lot of time for the patient to be on hold.
Yeah. So like Dr. Oshinsky was saying, when a patient logs into MyChart, they can update their medication information. So at their next appointment with Dr. Oshinsky will see that on Epic, and he'll be able to ask the questions. Okay, you're not taking it, I see. Why aren't you taking it? Or any other clinical procedures that they have to be followed. But after Dr. Oshinsky reviews it, that becomes part of the medical record.
The other thing that's terrific about the MyChart system is the whole process of telehealth. Since we are in the midst of the COVID pandemic, many of us have had to opt to going to telehealth type of portals, and many of them were unstable. They couldn't be used very well. The colors were off. You had to generate emails, etc. But through the use of MyChart, telehealth is now very much easier through the MyChart system in Epic. Isn't that true?
Yeah, so telehealth has become a very growing practice across the whole U.S. With COVID-19, we've taken telehealth as our communication points for patients. So it's really essential that using a way technology to communicate with the patient, and seeing what's happening over the last year and a half, kind of going into the new year. It's really essential that we find a way to communicate and be as best available to our patients as best we can. So MyChart provides that directly through the engagement tool. A patient can log into MyChart and schedule a in-person visit as well as a telehealth visit. They can also, they don't have to go to any other website. They don't have to go through any other app. They can log into MyChart and start their telemedicine visit right before their appointment. And same thing for our physicians and our clinicians. They can log into Epic and start their visit. So they don't have to do anything as well. MyChart is providing that video component as well. And I do want to make sure I mention that it's also available through the app. So when you download your MyChart app on your phones, you can start your visit right through the app. And it will be available, and you'll be able to communicate with the physician. You can test out your speakers, your microphone, to ensure they're working. And if they're not working, you have a little bit of time to contact the practice, say, I can't do this. So we can help you in this whole process. And that's why it's really important that, when something is, let's say not there, not available, there's some guidance needed, we have that help desk support available 24/7 to the patients, so they can make sure that everything on their end is functioning for their appointments.
And in fact, through the use of MyChart and Epic, I've actually had telehealth visits with patients on their iPhones in their car as they were in between certain things, and it really helped the patient that it was so transportable and so portable itself.
Yeah, it's really cool. I mean, the use of telehealth is I think is going to grow across the board. With our patients, really taking appointments at lunchtime, at work, in between meetings. So it's really kind of that essential tool, that access point that we're providing the patient. We don't want to, have the patient go through, loop through multiple doors to access anything. We want to make sure that they're accessing all this information right through that one door anytime they'd like. It's that perspective for a patient as well as a physician. We want to make it as the experience as best for a physician as well. So we really want to make sure that anything we're working on for MyChart, for Epic, and what the journey we're going through with Epic right now is standardization. So that one front door for a patient to access MyChart to, use your online tool for scheduling, use your messaging tool, view your results, communicate about your proxy. You can pretty much tweak all those things right through MyChart, and also start your telehealth visit. It's something that we haven't done previously before. And it's something that we're doing now. We're growing our practice across the board to engage in those exact tools. So anything you do as a health system with the health system is right through there.
Again, people are now used to a lot of the technology that's happened over the last 16 months. No one would have believed 16 months ago that you could do Zoom meetings across the country and actually conduct business across the country. Prior to the pandemic, most physician offices didn't do telehealth, didn't have a single system EMR, and some physicians may have even been on paper at that point. At this point, now that the people see that with work, that everything technology-wise works and that they may or may not have to be in the office 5 days a week anymore and that they can actually conduct business via the telehealth, via Zoom, the physicians and the healthcare system has learned the same thing, and we're trying to accommodate the patients and improve the patient experience as much as possible and improve the patient's health care as much as possible through the use of the electronic media.
Yeah, and it's growing across the board. You know, like you said, I think patients have realized that how important technology is going to be in their care when they're initiating their initial visit. You know, there's technology that's coming that for your annual physical that we don't need to come into the office at the moment. You know, all these vitals that a patient may need can be taken directly from home and communicated to the provider. We have wearables coming into play now a lot more than before. You have pulse ox, your blood pressure, all those things that can be taken via wearable. And if a patient's able to do that and communicate with the physician that I'm doing this consistently, my blood pressure is coming up. And if there's a deviation of the blood pressure, a practice or a physician practice can engage the patient way before their appointment time and make sure that they're able to get the tools they need to improve their current health status.
Well, again, hopefully every day technology will help improve the care that we render for our patients. And every day we see that we are becoming more like the Jetsons, that we will have, or Star Trek or any of those, you know, like they had on the TV shows. We're becoming more and more like that. And with that, improving the patient's healthcare experience and showing them that RWJBarnabas Health really is at the forefront of this technology explosion.
Yep. And that's the goal we kind of went into Epic with, right? We always start our journey with patient experience. And that's the number one important thing that we want to make sure that we're accommodating across the board. You know, technology is continuously going to improve, and RWJBarnabas Health is keeping up with that technology improvement across the board to make sure that we're able to provide the latest and greatest to our patients as best we can. And we wanted to ensure that, you know, any of the patients that are going through a MyChart or seeing our physicians, their care is communicated thoroughly to the patient as well as the practice across the board. And I think, you know, one of the things I do want to mention is that when I started at RWJBarnabas Health, it was very important that patient experience played a great tool for our communities, our practices, our hospitals. You know, one thing that we went in with Epic was we engaged our patient and family advisory council as well as our patient experience leaders across all sites to make sure they have a input in how we develop and the process that we develop for MyChart. So all the MyChart that, you know, any of the features that we've done, any of the processes that we've selected, it really speaks to our leadership. It speaks to our patient experience and family advisory councils. It speaks to our patient experience leaders across the board. It really speaks to the unification that we're building toward.
You left out one important group of people also, the IT people. None of this could have been accomplished, done without the expertise of the magnificent IT people all across the RWJBarnabas Health Rutgers system. You know, they've been spending endless hours, they were taught both during the hours, after hours, weekends, etc., to ensure the best patient experience possible. So it's the whole team, it's the leadership, it's the physicians, it's the nurses, it's the technicians, it's the clerks, it's the people who are the data punchers who are putting the information in. It's the people who are scanning the stuff into it so that every patient patient has the ability to see things. It's all of the interactions between the labs, the fact that if my patient goes to LabCorp, Quest, that information is immediately uploaded into the patient's MyChart, and they can see that within 24 hours of the time that they got their blood test done. In fact, if the person has a CBC, sometimes it's within 6 hours it's in the chart. And so it's not just, it's the whole team experience. It's what makes RWJBarnabas Health Rutgers who they are. It's that they understand that it's not just one person who makes it, it's the whole team that makes the patient experience good.
100%. Yeah, it's our whole team. Our whole team is amazing, and they've created something great. And it's only going to get improved across the board as we go with our different hospitals and our different go lives for Epic. We're continuously, as I mentioned, the IT team, the operational leaders, the IT leaders, we're working continuously to improve all the tools that we have at our disposal with Epic to improve our patient experience and patient care for the providers as well as our patients.
As we're ending this, leave us one last thought, whether it's a minute or so, of what you think, what the patient should understand about MyChart and Epic itself.
Yeah, so MyChart and Epic itself is a growing tool for our system. We started off on step one, and we're continuously improving it to make it an ideal scenario for our patients and our providers. As we are going down our Epic journey, it's really vital that we kind of encompass what patient experiences are across the board. So as we're going down this line, it's important for us to also realize that patients are the core point. I encourage everyone to sign up for MyChart, take a look at the tool, and we have available tools for feedback. Patient experiences across the board, not just MyChart. So definitely feedback is great. We're continuously improving. So if there's some functionality that may not be working, we'd love to know. And that's what the support number is there for, to help us guide that.
Thank you, Harshal, for being here. Thank you for everything that you do for the RWJBarnabas Health system. And thank you for helping to implement Epic and MyChart.
Thank you, Dr. Shinsky, for having me. I really appreciate it. Great talking to you.
This concludes today's episode of Robert Wood Johnson University Hospital Somerset's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 888-724-7123. To sign up for MyChart, please go to our website at www.rwjbh.org/Somerset.